Dear participants of the International Summer Master Schools 2020, I present to you the educational program Veterinary Medicine and Bajanova Asimsierikova, candidate of Veterinary Science, Associate Professor of the Department of Biological Safety. I present to you a report on the topic Pathological diagnosis of tumor of the carnivorous. Plan of the practical lesson: characteristics of tumors, classification of tumors, series of tumors, origin, frequently occurring tumors, carnivorous. Thesis, statements, and introduction. A tumor is an abnormal growth of body tissue with gain mutation leads to dysregulation of growth of cells and differentiation. This abnormal growth usually forms a mass. When it forms a mass, it may be called a tumor. Next, tumor is basically a disease of uncontrolled cell division. Tumors can spread to other parts of the body, which leads to excessive and unregulated growth of these cells, often at the expense of surrounding normal tissue, and the damage at the cellular level leads to violation of which leads to death and intoxication of organism. The growth of a neoplasm is uncoordinated with that of the normal surrounding tissue, and it persists growing abnormally even if the original trigger is removed. They have their own specific exchange, the nature of which is not fully decrypted. Next, tumors can arise from any body tissue. They are widespread in the world, including the humans, cold-blooded animals, and plants. Oncology is a branch of medicine that deals with the prevention, diagnosis, and treatment of cancer. A medical professional who practices oncology is an oncologist. The name's etymological origin is the Greek word onkos, meaning tumor, volume, or mass, and the word logos, meaning study. In pets, tumors occur in all species, most commonly in dogs. Ear cancer is more common in rats. Gastrointestinal and urinary cancer are more common in humans than in animals. Spontaneous tumors in monkeys are very rare. Tumors are very rare in laboratory animals, rabbits, and guinea pigs. Next, cancer will remain one of the leading causes of death worldwide. Approximately 15% of deaths from cancer occur in developed countries. Oncological disease have certainly occupied in the second place in the structure of causes after cardiovascular pathology for many years. Science is now a downward trend in mortality from the later. Tumors have a clear change of becoming the leading cause of death in the 21st century. Next, the most common tumors are registered in dogs and cats aged 6 and 10 years, horses and rats 5 and 13 years, chickens 2 years. Breed and coat colors of animals play a role in the onset and development of the tumor. In dogs, tumors are more common in boxers and terriers. The disease occurs in cattle that have areas of unpigmented skin or conjunctiva. Breeds such as Hereford. The important characteristic by any tumor are cytological and histological differentiation. They may be spherical, oval, round, polygonal, or elongated in shape. Their walls are thin and made up of cellulosome. They may either be closely packed or have small intercellular spaces. Next, consistency depends on the type of cells, types including the blood vessel cells, immune cells, or stomach cells. For example, some tumors are benign and consist of non-carrier cells, or they are malignant. Malignant tumors are cancerous, and the cells can spread to other parts of the body. Tumor size ranges from microscopic to mass larger than the host. Ovarian vascular hematoma is a very rare ovarian tumor-like anomaly observed in cows with the ovary weighing 170 kilograms. Tumors can be single and multiple. Next slide. Definition and the properties of tumors: cell proliferation, ATP, and tumor organoid cultures. Autonomous replication of tumor cells seems to be an essential factor in the definition of the malignant tumor itself, although tumor cell proliferation is in general controlled by the host response, including immunological reaction and the microenvironment. Autonomy in tumor has a relative character is tumoral fabric constantly receives various nutrients, hormones, and cytokines from an organism, constantly is affected by immune system and adjacent not tumoral fabric. Thus, the autonomy of a tumor shall be understood not as full independence of tumor cells of an organism and is as question by tumor cells of ability of self-government. Next. Atypia is used to describe atypical cells. In tumors, 4 types of atypia are distinguished: morphological, functional, biochemical, antigenic. Morphological atypism, represented by 2 variants, tissue and cellular. Tissue is expressed by changing the size and the shape of tissue structures with the appearance of ugly tissue formation of different magnitude. Cellular consists in the appearance of polymorphism of cells, both in form and size, in enlargement in cells of nuclein. Malignant tumors have both types of atypia: benign only tissue atypia because they are built from mature differentiated cell elements. Next. The biochemical atypia is shown in metabolic changes in tumoral fabric. The antigenic atypia is shown in education the tumor specific of antigens. The functional atypia is characterized by loss by tumor cells of the specialized functions inherent in similar mature cells. The organoids. Any tumor consists of specific about fabrics and a poorly differentiated connecting fabric in which there pass circulatory and absorbent vessel nerve fibrils. Next. Tumor parenchyma is its specific tissue. It corresponds to the tissue from which the tumor developed. By this tissue, tumors get their name. The tumor stroma consists of collagen and fibers and a basic amorphous substance. It houses tumor cells. Expansive growth of tumor and infiltrative tumor growth patterns are distinguished. Next. Expansive growth of tumor can cause obstruction of organs or vessels, leading to serious problems with the functioning of the obstructed organ or vessels. It is easy to remove such tumors. Benign tumors have expansive growth. Infiltrative tumor growth patterns is characteristic to malignant tumors. Cancer that has spread beyond the layer of tissue in which it developed and is growing into surrounding healthy tissues. Also called invasive cancer. Next. The term metastatic cancer is usually only used to describe solid tumors that have spread to another part of the body. Some cancer, such as leukemia, lymphoma, and multiple myeloma, relapse is the recurrence of a tumor at the place from where it was removed surgically. Usually, relapse occurs where tumor cells are preserved. There are 2 types of tumors: benign and malignant. Benign tumors. A tumor is an abnormal growth of cells that serves no purpose. Benign tumor is not a malignant tumor, which is cancer. It does not invade nerve tissue or spread to other part of the body the way cancer can. Next. Malignant tumors, those tumors capable of invasive growth and metastasis, often fatal if not treated effectively. The malignant tumors are referred to as cancer. The invasion and infiltration of malignant cells is characterized by the fact that they leave the tumor tissue and penetrate the neighboring tissue. Symptoms of malignant tumors: sudden appearance, rapid infiltrating growth, the information of relapse and metastasis. They never turn into benign. Etiology of tumors, the most difficult and tangled question in oncology, finally is not solved in spite of the fact that a huge number of institutes around the world deals with this problem. Now, there are 4 theories about developing of tumors: physical and chemical, viral, dysantagenic, and polyetiological. Physical and chemical theory. Chemical theory believes that various physical and chemical factors play a major role in the emergence of tumors. Physical factors include the effect of ionizing radiation, radioactive isotopes, and other. Chemical factors include flavoring hydrocarbons, amines, nitric compounds. Next, viral theory. The occurrence of a tumor is due to viruses. The viral etiology of some tumors in frogs, birds, rabbits, skin papillomas in rats has been proven. Dysantagenic theory is a disorder of the body, embryonic development. Polyetiological theory is a wide variety of causes. Name and classification. Cancer are usually named using carcinoma, sarcoma, or blastoma as a suffix with the Latin and Greek word for the organ or tissue of origin as the root. An adenoma is a benign tumor of epithelial tissue. Angiomas, a benign tumor derived from cells of the vascular or lymphatic vessels walls. Glioma is a type of tumor that occurs in the brain and the spinal cord. Next, carcinoma, cancers derived from epithelial cells. Sarcoma is a cancer that arises from transformed cells of mesenchymal origin. Cancer are additionally classified by the 7 types of cells that the tumor cells originated from. Types include epithelial tumors, exocrine and endocrine gland and epithelial tumors, mesenchymal tumors, tumors of melanocytes, tumors of the nervous system and brain tumors. Tumors of lymphocytes are always malignant, and teratoma. Next, epithelial tumors. 1. Benign, 2. Malignant. Benign tumors causes adenoma and papilloma. Papilloma is a type of stratified epithelium. Papilloma is often a small white or pink sessile. Adenoma is from the prismatic and the iron epithelium and mucous membranes and the iron organs. Carcinoma refers to a malignant neoplasm of epithelial origin or cancer of the internal or external lining of the body. Next, classification of sarcoma. Squamous cell carcinoma: 1. Keratinized, 2. non-keratinized. Adenosquamous carcinoma, mucinous carcinoma, solid cancer, and solitary fibrous tumor, medullary thyroid cancer. Next, in the drawing you can see colorectal cancer, stomach cancer, vaginal cancer, cancer in dogs, breast cancer, connective tissue tumor, benign fibroma, myxoma, and other, malignant sarcoma. Surgical treatment: radical and palliative. Radical type photo and palliative type photo. Dogs and cats are the most common types of pets on Earth. There are more than 400 breeds of dogs and more than 2 breeds of cats in the world. The role of dogs in the national economy and in human life in general is very great. In our country, these animals are used in security and horticultural, border and custom services, criminal cases, protection of people and animals. Dogs and cats are also often used as laboratory animals in biology, medicine, and veterinary medicine. The rapid development of any veterinarian is to conduct research on the study of pathological histological changes in the internal organs of dog. Due to the development of the country's economy, the number of domestic animals in the livestock sector of Kazakhstan is growing from year to year. Next slide. Among dog breeds, tumors are most often detected in German Shepherd and Boxers at the age of about 5 years. The skin and the subcutaneous tissue, mammary glands, and genitals are mainly affected. Next. Dogs are increasingly diagnosed with malignant and benign neoplasm in the body. Their localization can be different from the skin and the internal organs to the brain. The reason for frequent detection of neoplasm is an accurate diagnosis that allows you to detect the pathological process in a timely manner and take measures to eliminate the consequences. Next. Timely diagnosis of tumor processes in the dog's body allows you to establish an accurate diagnosis and develop an adequate treatment regimen. Any pathological change in the pet's condition should be examined by a specialist in the condition of a veterinary hospital. General blood, urine, and fecal analysis is carried out if necessary. Ultrasound and X-ray examination are prescribed. Next. Causes and types of tumors in dogs. Tumors in dogs are characterized by malignant and benign course. Benign neoplasm grows slowly and develop. They have their own growth limiting capsule. With late detection, the tumor is able to grow to enormous size. A characteristic feature of benign tumors is the absence of metastasis. When removing this type of neoplasm replaces are extremely rare. The danger of benign tumor is that during its growth, it squeezes the tissues and adjacent organs and vascular plexus, provoking dangerous violations in their work. Next. Another type of tumor is malignant. They are characterized by continuous and almost uncontrolled growth accompanied by the division of mutated cell structure. Malignant neoplasm do not have their own capsule. This provokes the process of free germination of cancer cells in nervy tissue structures, causing necrosis of healthy cells. These types of neoplasm is not always characterized by huge sizes. The danger of malignant tumors in poisoning the body with products of its own vital activity and decay. Next, symptoms and the diagnosis of tumors in dogs. Symptoms of tumors in dogs differ depending on the location of the focus of the pathological process. Neoplasm in the mammary glands in dogs, especially unsterilized pitches, are more often malignant and can metastasize to other organs. A sign of neoplasm is swelling and hardness in the area of milk bags, which can only be detected by palpation. Symptoms of cancerous changes in the skin are specific nodules. Over time, They merge into a single neoplasm and reach large sizes. Malignant and benign tumors formed in the brain region are characterized by a decrease in overall motor activity. Attempts to avoid bright lighting, convulsive phenomena, impaired coordination of movements, heat, tilts. Next, common signs of cancer development in the dog's body are a sharp decrease in body weight, refusal of food and favorite treats, disordered chair of the chronic type, which has no apparent predisposing factors. Appearance of blood veins in the vomit, changing the volume of the abdomen, the appearance of a repulsive putrid smell from the mouth, convulsive seizures, and loss of consequences. Next. On the time, diagnostics can determine the cause of the pet's malaise and prescribe the most appropriate treatment. It's necessary to carry out instrumental diagnostic method X-ray examination of the abdominal cavity and sternum, ultrasound diagnostic of internal organs. Biological material is also collected from the area for further examination under a microscope. Biopsy. Next, treatment of tumors in dogs. Depending on the symptoms of the tumor in the dog and the exact diagnosis in the therapy will have its own differences. A diagnosed benign tumor in a dog is not large and does not require organ surgery. Drugs that stop the growth of the tumor are prescribed. It is also necessary to regularly bring the dog for examination to monitor the clinical picture. For the treatment of cancer in pets, the following methods are used: surgical excision, radiation, chemotherapy. Next, prevention. The field of oncology in veterinary medicine is developing quite rapidly. In this regard, new methods and schemes for the treatment of malignant and benign neoplasm regularly appear. Prevention of the development of tumors in dogs is to comply with the norms of feeding, timely treatment of chronic systemic disease. To prevent dangerous consequences of the development of a tumor in the body, regular preventive examination by a veterinary specialist will help. If you notice a slight malaise in your pet, do not let the situation take its course, but raise the contact a professional. Most cancers do not appear until they reach the last stage, which is difficult to treat. Thank you for attention. Thanks.